Around 20-30 years back, when this neurootology or the science related to vertigo and balance disorders didn't have much development in its field, then there was a myth amongst the physicians and clinicians that there may be some link between the cervical spondylitis and vertigo. Hi, I'm Dr. Nilotpal, vertigo consultant from Medica. So there's a common myth, and every day we get a lot of patients who come to us with a complaint and with a weird thing that, doctor, I'm having cervical spondylitis and I'm having a stiffness in the neck, and that is causing me vertigo. And I am being on treatment and has been to several orthopedics physicians, then rehabilitation therapist, then everyone has said that we are treating you for spondylitis and eventually you are going to get a relief from vertigo. But it's been 3 years now, sir. There is no improvement in my vertigo attacks. So, if you are amongst those, or if anyone of your family members or friends are having these issues and are not been cured after the cervical spondylitis treatment, then please listen to the entire video. So, around 20-30 years back, when this neurootology or the science related to vertigo and balance disorders didn't have much development in its field, then there was a myth amongst the physicians and clinicians that there may be some link between the cervical spondylitis and vertigo. And majority of these vertigo patients were dumped into a common dustbin called cervical spondylitis, and they were been given all lot of cervical copulars, traction exercises, and lot many more. But in the eventual years, the science in the field of neurootology started to grow, and there are a lot of scientific evidences and scientific publications from which it has now been fully scientifically justified that cervical spondylitis is in no way connected to the vestibular system. What happens is the cervical spondylitis usually happens into the lower cervical vertebra. Now, for cervical vertebra, there are few cervical vertebra which are there in the upper part and few cervical vertebra which are in the lower part. So, cervical spondylitis usually happens in the lower part of the cervical vertebra. And the balance system is usually connected to the upper cervical vertebra. So, there is no definite link between cervical spondylitis and the vertigo scientifically. Then, what was the myth? What happens is sometimes there is another condition which is often confused with the rotatory vertigo is a cervical stiffness. So, there are few muscles in the cervical region which sometimes get stiffened and ultimately blocks the neuroreceptors present near the muscles, which lead to a kind of symptoms called head ataxia. The patient feels that his head is not stable on the shoulders. This head ataxia is completely a different entity and is no way connected to the rotatory vertigo. And the treatment of head ataxia is also different. So, if you are having a problem related to chronic cervical issues, which has led to this problem of giddiness and neck pain, then I would advise you to visit your neurologist soon. Thank you.